The next update we'll be taking will be on non-communicable diseases and how to integrate them. So, Prof, is this something you think we should be considering in a setting in the HIV program?
Honestly, HIV program in Nigeria doesn't have a choice because our patients we now know don't die of HIV and AIDS again. And then the prevalence of NCD is actually becoming a big issue. So at the clinic, we must be able to acquire skills to be able to undo a number of non-communicable diseases that we are going to be seeing more frequently in HIV-infected patients who are living as long as people who are not HIV infected. So the issue of integration of service becomes very, very primary. The data you are trying to show is whether if we do this integration properly, whether it actually even benefits HIV treatment itself. That's the data I'm looking forward that you are going to be able to share with us.
All right. Yes, so Dr. Birungi and colleagues presented at the IAS how their findings from integrating blood pressure control among patients receiving integrated care for HIV, diabetes, and hypertension in the primary healthcare facilities, and they looked at this in Tanzania and Uganda. So we'll look at what they presented. Of course, we know that hypertension and other comorbidities remain the leading causes of morbidity and mortality in sub-Saharan Africa. And patients with PLHIV, as you just alluded to, also have comorbidities related to hypertension as well. WHO has defined integration in terms of the healthcare system as bringing together inputs, delivery, management, and organization of services related to diagnosis, treatment, care, rehabilitation, and health promotion to improve access, quality, and user satisfaction and efficiency. So this is WHO's definition that came out in 2020. So this study evaluated the effect of integrated care of HIV, diabetes, and hypertension, and they looked at the effect on retention, viral load suppression, and some other outcomes.
Fantastic.
Yes, so we will look at this and their findings. And the study is actually referred to as Inter-Africa. And so it's a pragmatic cluster randomized control trial used to select 32 primary healthcare facilities in Uganda and Tanzania. So, and the inclusion criteria, the participants needed to be 18 years or over with HIV infection, diabetes, or hypertension. And then essentially, standard of care was compared to an integrated care. So the control is the standard of care, and then the intervention is those that were integrated. So the primary outcome was retention in care, viral suppression. And then secondary outcome that they looked at was blood pressure, blood sugar, and then costs, and also adherence. And they were followed up for 12 months. So this is the flow chart of the study. So before integration, which is the standard of care, there is the HIV clinic as standalone, hypertension clinic as standalone, and then diabetes clinic as standalone. Yes. So the integration, that's the Inter-Africa study, they brought all of this to a one-stop chronic care clinic. So diabetes, hypertension, and HIV were managed in one. And the interventions, and of course the outcomes after 12 months. Essential intervention, what happened was that consultation was done by the same clinicians for all three conditions.
Okay.
And then same waiting area, same triage, same dispensing, same lab and records, and same clinic appointment in the intervention arm. Same, everything was just same. And then the services provided by government healthcare worker, okay? And then the measurements were retention in care, disease control, acceptability, and cost. So this is an interesting model. So in terms of the outcomes, there are some other outcomes that we are not discussing here. We're going to focus essentially on the blood pressure control and the blood sugar control. And if you will see from these results, in the integrated arm and the standard of care arm, and when the statistics was done, there was no significant difference in all of them. In all of them, whether we are looking at blood pressures, whether it was change in systolic blood pressure, change in diastolic blood pressure, change in either blood pressure or fasting blood glucose, there was no difference in both arms, standard of care, and then so our take-home points, there was very good retention and viral suppression in both groups from this study. Some measures of blood pressure and blood glucose control appear to trend in favor of the integrated care group, but statistical significance was not seen, okay? And then barely half of those with high blood pressure and 1/4 with glycemia reached their targets even in the integrated group. And then, so clinicians need to pay attention to blood pressure and blood sugar management in people living with HIV. So, Prof, as we round up, you can see what has come up here.
But I guess the point that didn't come out very clearly
Yes.
is the fact that in the integrated service provision,
Yes.
The person that has hypertension and has diabetes and has HIV does not have to attend 3 clinics.
Yes.
You are attending same clinic, and
Yes.
the outcome of treatment is as good as if you are attending those clinics alone.
That's a very important take home.
That
Yes.
point should be made here.
Yes, yes.
So if our facilities, the healthcare providers, are trained enough to be able to undo NCDs together, I think it's a lot better for our patients.
Yes. That's a very important point. And it's when patients, if we have difficult to manage patients, then we can refer them to specialist clinics.
Exactly.
But regular patients with straightforward blood pressure and diabetes, I think the same clinician should be trained to manage both, as you are suggesting.
I agree.
Yes, so I want to thank you very much, Prof, for your insights and your inputs into this discussion. I think you have enriched it, and it's really, really good.
Thank you very much.
So I want to thank you again, and listeners and viewers, we just want to encourage you to stay tuned. We will be bringing you more updates from upcoming conferences. Thank you very much.